I'm Christine Shergan, and I'm a PA student at Nova Southeastern University. I'm going to be the one doing your head, eyes, ears, nose, and throat exam today. So please excuse me while I go wash my hands. All right, I'm washing my hands. My patient appears ready for the exam because she has no glasses or no hat. Okay, so my hands are washed. So my patient appears in great health. She appears in no apparent distress, and I see no signs of peripheral or central cyanosis. So I'm going to jump right into the head. So I'm inspecting for shape, contour. I'm inspecting for any abnormalities, as in deformities or lesions. And I'm looking for symmetry. I'm looking for hair distribution. And also I'm looking for symmetry in the face. Her face is very symmetrical and it's without any apparent lesions. So I'm going to go right in and I'm going to look at your hair. Your hair texture is very beautiful, very healthy. So your hair distribution is great. Now I'm going to just palpate. Again, I feel no deformities. I feel no lesions. Now this brings me into the scalp. I'm looking at the scalp to see if there's any infestations. I'm looking at the scalp if there's any scaling, which I see no indications of. So she is very normocephalic. Okay, so that brings me into palpation of the face. I'm going to move your hair if you don't mind. Thank you. Okay. Just need to palpate to see if there's any tenderness. There is no tenderness elicited. Then I palpate her temporal arteries, and there are no temporal artery tenderness elicited either. So that brings me right into your sinuses. Sorry. So I'm just going to palpate your sinuses. Good, no tenderness. So I'm going to percuss, so I'm going to tap very gently. Okay, so your frontal and maxillary sinuses have no tenderness. That brings me right into the parotid gland. The parotid gland is non-palpable. Brings me to the T and J joint. So I'm going to have you open your jaw for me. Good, close. Protrude it out, please. Good, and then swing it side to side for me. Great, I have no crepitus indicated. So this brings me to your muscles of mastication. So first your masseter. So clench your jaw, please. Thank you. One more time. Great. So that means that your cranial nerve 5 is intact. So next to your cranial nerve 7. So I'm gonna have you raise your eyebrows. Good. Close your eyes, please. And let me open. Great. Okay, show me your teeth. Good. Smile. Beautiful. All right, frown for me. Great. Now puff out your cheeks. Don't let me take out the air. Great. Perfect. Your cranial nerve 7 is intact. So this brings me to the eyes. So right now I'm just inspecting the eyes. We're inspecting for any ptosis, exophthalmos, any edema. I'm looking for any lesions. And I am seeing none of that. Okay. So now what I'm going to do is I'm going to palpate your lacrimal duct. Okay, so there's no tears, so that means no regurgitation of the lacrimal duct. So I'm just going to lift your eyelids and look down for me. Good. Look up for me, please, and right and left. Beautiful. There's no injection, no foreign bodies. Again, no edema, no discoloration. So very healthy. Okay. So that brings me right into your visual acuity test. And you're wearing contact lenses, correct? Yes. Okay. So what I'm going to have you do is cover your left eye, please. Thank you. And read the smallest line that you can read.
93782
Great. Okay, go ahead and cover your other eye. Awesome. Again, please.
93782
Perfect. And then uncover both eyes and go ahead and read.
93782
Perfect. OD 2020, OS 2020, OU 2020, and that means that your cranial nerve 2 is intact. Okay, so what that brings me to is, all right, go ahead and stand up for me. Beautiful. Okay, so what I'm going to do, I just have you stand up so we're on the same level here. So I'm going to bring my fingers forward and you're going to tell me exactly, say now once you see them, and additionally point them out. Okay?
Now.
Beautiful.
Now.
Wonderful.
Now.
Perfect. You did awesome. Go ahead and take a seat. Okay. So now I'm going to use my hand again. Henley. All right. So what I'm going to have you do is follow this with your eyes only. Please do not move your head, okay? All right. Perfect. So her extraocular movements are well within normal range. This means that cranial nerve 3, 4, and 6 are intact. And additionally, I didn't see any nystagmus, and I didn't see any lid lag. So, fantastic. Okay, so what I'm gonna have you do is I'm gonna have you look right at my nose, please. Perfect. All right, I'm gonna have you, all right, again, one more time at my nose. Beautiful, okay. There is no strabismus indicated. So next what I'm gonna do is I'm just gonna shine this light in the lateral portion of your eye. Again, you're just gonna keep staring right at my nose. Perfect, there's no crescent shadow. Okay, so what that brings me into next is I'm just gonna shine this light right in your eyes. And then testing your pupillary. Good, and then one more time. Okay. And pupils are 3 millimeters. They're equal, round, reactive to light, and accommodation. So I'm gonna do one more test before we move. Right, are you okay?
Yes.
Okay. So I'm gonna have you stare right at the tip of this pen light, okay?
Yes.
And then follow it with your eyes. Good, good, good. All right, now look at the window pane. Beautiful, now back at this. Wonderful, okay. So pupils converge and eyes converge and pupils accommodate to near objects. All right, so that brings us into our fundoscopic exam. So I'm gonna go down the lights real quick. Okay, I'm gonna remove my glasses. All right, and
Contacts are really dry.
I'm
I should
sorry.
have taken them out. No, I should have taken them out. I'm sorry.
it's okay. Sorry.
So if I blink a lot, no, don't worry. If I blink a lot, sorry.
You can blink as much as you want. Just I'm gonna have you keep staring at that window pane, okay? All right. So I have turned my diopter to 0. Okay. All right. So red reflex is present, and I see that the cornea, anterior chamber, the lens, and the vitreous is clear. And then it's bringing me to the optic disc. The optic disc is orange. It has very clear margins, and then the cup to disc ratio, the cup to disc ratio is 0.5, and then I'm going over my 4 quadrants, and I see my AV ratio is 2 to 3, and I see no nicks, and I see no spasms, and I also don't see any hemorrhage or any exudates. So I'm gonna have you look right at my light. Perfect, and I see no lesions in the macula. Do you need a break?
No, it's good. I'm
Okay.
so sorry. It's literally my contact lens. It's not you. You just do your thing.
Bringing my diopter back to 0, okay? Okay. Ready?
Yeah.
Okay. So again, my red reflex is present, and I see that the cornea, anterior chamber, lens, and vitreous are all clear, which brings me to the optic disc. See that the optic disc is again orange, again with distinct margins, and I see that the cup to disc ratio is 0.5. Additionally, I'm going over my 4 quadrants again, and I see some very beautiful veins. I see the AV ratio is 2 to 3. I see again no nicks or no spasms, and I see no hemorrhaging. Additionally, I see no exudates. I'm gonna have you one more time look directly in my light. And perfect, no macular lesions on your left eye as well. Okay. So that concludes our fundoscopic exam. So let me turn the lights back on and put my glasses back on. You okay?
Yep.
Sorry.
Savage.
Okay.
Nope, I'm
So that brings us into our ear exam. I'm so sorry.
Mine is not your fault.
That brings us into our ear exam. So basically what I'm going to do is I'm inspecting your ears, and I'm just inspecting them for any deformities. I'm inspecting them for any drainage, lesions, any discoloration, and I see none. They're very beautiful. So I'm gonna palpate for any tenderness. Any tenderness? No. Okay. No tenderness in the auricles. Okay. No tenderness in the tragus. And then I'm just looking to see any discoloration in the mastoid. None over here, and beautiful. None over here. No discoloration in the mastoid, and no tenderness in the mastoid as well. Okay. So this brings me to our ear exam. Okay. So I'm gonna start with your right ear. All right. So I'm just gonna brace with my hands here. So that way, if you move, I move with you. Okay, and I see that our external canal is clear. And I see our tympanic membrane is very pearly gray and translucent. I see that light reflex, and I see that it is antero-inferior. And I also see the malleus, I see the umbo, and pars flaccida and pars tensa as well. And then additionally, I see that the middle ear, there's no fluid. So would you mind plugging your nose and popping your ears for me? Beautiful, that tympanic membrane is mobile. Okay, same thing. Again, if you have any discomfort, just let me know, okay? Okay, so I'm inserting. And you see again the external canal is unoccluded. And I see that tympanic membrane again is pearly gray and translucent. I see the light reflex. That is going to be antero-inferior again. I see the malleus, I see the umbo, pars tensa, pars flaccida, and they are also undistorted. Same thing in the right ear. And I see again, middle ear has no fluid, and can you do the same thing? Plug your eyes and pop your ears again. Perfect. See the tympanic membrane is mobile again. Very beautiful. Okay. So now I'm going to do a hearing test, okay? So I'm going to have you, so I'm going to have you close your eyes, and then I'm going to have you tell me exactly right, left, or both where you hear the noise, okay?
Both. Left. Right.
Perfect. Okay, so that means that our cranial nerve 8 is intact. Okay, so I'm going to do what's called a Weber test. So you're just going to tell me again if you hear the noise best in right, best in left, best in both.
Both.
Perfect. Okay, so that means that our Weber test is midline. So I'm going to activate this and put it on your mastoid. And you're going to tell me when you stop hearing it, and then I'm going to put it up to your ear, and again, you tell me when you stop hearing it.
Do I hear it? Stop.
Perfect. Okay, same with this ear.
It's gone. It's gone.
Great job. Okay, so the Rhines test, meaning that is indicative of air condition is greater than bone. Air conduction is greater than bone conduction bilaterally. Okay, so that brings us to the nose exam. Yeah. Okay. Sorry. All right. So first, I'm gonna inspect your nose. It is midline. I have on my gloves real quick. Your nose is midline. There's no lesions. Very beautiful. Okay. So what I'm going to have you do really fast for me is I'm going to have you occlude your left nostril and inhale with your right. Great. Same thing with the other side for me, please. Perfect. Okay. So now what I'm going to do is a smell test. So I'm going to have you close your eyes and cover your left nostril, please. And what does this smell?
Tea.
Perfect. Okay. Okay, and same thing with your other nostril. What do you smell?
Lemon.
Yeah, great job. Okay, so that means that your cranial nerve 1, your olfactory nerve, is intact. So, all right, this brings us. Are you okay?
Nothing, yeah.
All right, this brings us.
I think I switched the smells as well, but yeah.
No worries. It's still intact. Okay. So this brings us to. Okay. So what I'm gonna have you do is kind of perfect. Exactly. Okay. I'm gonna insert this. All right, and slowly put your head down for me. Slowly, beautiful. All right. Same thing on the other side. And I'll let you put up your nose. Okay. Again. Inserting. All right, slowly put your nose down. Beautiful. Okay, so the nasal mucosa is very pink, very moist. I don't see any lesions. Nose is great. Okay. So this brings us into your mouth exam. So let me dry my hands. Okay.
For the next set of gloves.
Yeah. This is again the hardest part. Oh, there's now.
It's okay.
Sorry.
I'm not on time limit.
You're not. Okay, sorry, one more. We're halfway there. I promise we're going to finish halfway. Okay. Alright. Okay. So the first thing I'm going to do is inspect your lips. Your lips look very pink. They look very moist. I don't see any lesions. I don't see any cracking. I don't see any ulcers. Beautiful. Okay, so then I'm going to inspect your gingiva. So your gingiva is very pink, very moist. I don't see any inflammation, no bleeding. That's so beautiful. Okay. Now I'm going to take my tongue depressor and my trusty dandy pen light. Okay, so what I'm just going to do is I'm going to put this right along your teeth just to hear the sounds. Okay, open your mouth for me. Good, good. Fantastic. And smile for me. Okay, so your teeth are very white. You have great oral hygiene. Your teeth are non-sensitive. Perfect. And your breath is very non-offensive. Okay. So next thing we're going to do here is I'm going to have you open your mouth real wide for me. And here I'm looking at the color of your mucosa. I'm looking for any white lesions. I looked for any ulcers. Very healthy. Okay, so next what I'm going to do is I'm going to have you lean your head back a little bit, open your mouth wide and say, ah. Okay, perfect. So your tonsils are absent, which is good. And then your uvula rises with phonation and it's midline, so that means that your cranial nerve 10 is working. Okay, so next what I'm going to do here. Stay. Okay. Here's the fun part. Okay, so I'm going to have you stick your tongue out at me. All right, wiggle it. Tongue is midline, so that means that your cranial nerve 12 is working. All right, so I'm gonna have you stick your tongue out at me one more time. Okay, and I'm just inspecting it for any lesions, any nodules, any of that. And your tongue is perfectly healthy. I also looked at the color, again, pink and healthy. Okay, so without the pen light, don't need that. All right, so I'm gonna have you open for me. I'm just gonna palpate your senses and working ducts. Good. Good, nice and healthy. Underneath your tongue for me. So I was palpating for any nodules, any abnormalities, any lesions, any of that, and now I'm just going to go right around your lip line again for any lesions, any ulcers, any of that, and your gums and your mucosa are perfectly healthy. Okay, that concludes my mouth exam. Excuse me, and then that brings me to your neck exam. Okay, so first thing I'm going to look for is I'm going to look at your trachea. So can you extend your head just a smidge? Okay. So your trachea is midline and it is mobile, so that's very good. Now I'm looking at your neck skin. And I'm looking and I'm not seeing any scars, I'm not seeing any lesions, I'm not seeing any moles, I'm not seeing any discoloration, very healthy looking skin. So now I'm gonna go to your lymph nodes, okay? So first, I'm going to your occipital lymph nodes. Wonderful. And then your post-auricular lymph nodes. Great. Then your pre-auricular lymph nodes. Awesome. Then your tonsillar. Then your submandibular. Then your submental. And then going all the way back here to your posterior cervical chain. Good. I'm going to your deep cervical chain. So this is underneath your sternocleidomastoid. Good. And then your anterior cervical chain. Great. And this brings me to your supraclavicular. Oh, I'm sorry. I keep kicking you. I'm so sorry. Perfect. And none of your lymph nodes are palpable, so that means no lymphadenopathy. So after your lymph nodes, this brings me to your thyroid. So do you need water? I'm gonna have you swallow. Are you sure? Okay. Okay. So I'm gonna have you lift your head just a smidge and swallow for me. Beautiful. So I've located your thyroid. So now I'm gonna have you look down and to your left for me, please. Okay, so I'm palpating the left lobe with the thyroid. Now look right and down for me. Palpating the right lobe with the thyroid. So the thyroid is completely normal in size and shape. I felt no nodules. I felt, well, you felt no tenderness. So thyroid perfectly healthy. So next thing we're gonna do is your neck range of motion. I'm gonna have you look up and look down, look left, look right. I'm gonna have you bring your left ear to your left shoulder, right ear to your right shoulder. Beautiful. Now the last thing I'm gonna do is test your cranial nerve 11. Yep. So push against my hand. Good. Push against my hand. Beautiful. And then one more thing. Put your shoulders up for me. Great. So your cranial nerve 11 is intact. And this completes our exam today. Thank you so much for being such a wonderful patient, Tiffany.
Thank you for being a wonderful provider, Christine.
Thanks.